So here's a closer look at how Connecticut is doing at getting shots into arms. According to the Centers for Disease Control, Connecticut has administered 381,000 first and second doses. I know Zania just touched on this. That's 67% of what we've received from the federal government so far. When you look at it over time, you can see the number of doses sent to Connecticut grow from December until now, deliveries accelerating and our vaccination clinics keeping pace. There is, though, a long way to go. So far, only 8% of Connecticut's population has received at least the first shot. The percentage of people who've gotten their second shot, just under 2%. Experts say we would need that number to be closer to 75 to 80% to reach herd immunity.
And touching on that number, again, 8% of Connecticut residents have gotten the vaccine, but now that the vaccine's here, the variants are also here. Right now, there are 3 concerning variant strains of the coronavirus. We have the UK strain, which the White House expects to be the dominant strain by March. We also have the South African strain and the strain from Brazil. The vaccines will still be effective against those strains, but maybe slightly less than effective than 95%. Scientists are concerned about mutations in COVID spike proteins, which the vaccines are based on.
The virus only mutates when it is inside a host, and it's going to mutate more if the virus is replicating more.
If we don't reach herd immunity in the next 6 to 8 months, then there's a possibility that it might start impacting the vaccines that have already been administered.
Now, there is some good news here tonight. The federal government is boosting vaccine supply to the states and invoking the Defense Production Act to manufacture critical supplies like needles, vials, masks, and testing kits as well. For the very latest information about the COVID-19 vaccine tonight, just text the word vaccine to this number on your screen, 860-527-6161.